You know that moment. You're sitting in a hospital bed. The room is quieter now. The rush of the emergency department has faded. You've been admitted. A knock on the door. Someone walks in, introduces themselves, and says, I'm the hospitalist taking care of you. And you think, wait, hospitalist? Where's my doctor? Like, see, why am I not seeing the doctor I've had for years? Who is this person? Are they replacing my doctor? And if I need a specialist, who decides that? And when I leave, will any of this even make it back to my regular doctor? There's something important I want you to understand. The hospital system has changed over the past 25 years, not because your doctor doesn't care, not because something went wrong, but because medicine has grown more complex. And to manage that complexity, a new role emerged. That role is the hospitalist. Let's pull back the curtain. What is a hospitalist? A hospitalist is a physician, nurse practitioner, or physician assistant whose entire job is to take care of patients inside the hospital. That's it. They don't have an office practice down the street or split time between clinic visits and hospital rounds. And they are physically in the hospital, managing hospitalized patients every day. Think of it this way: your primary care doctor is like your long term architect. They know your blueprint, your history, your patterns. A hospitalist is the on site construction manager when something urgent or complicated is happening. They are there all day, every day, focused on patients who are admitted, and that focus matters. Why aren't I seeing my regular doctor? And this is one of the most common and emotional questions patients ask. Why isn't my doctor here? Years ago, most primary care doctors did both. They saw patients in clinic during the day, drove to the hospital to see admitted patients, rounded early in the morning, and came back at night if needed. But medicine changed. Hospital care became faster, sicker, more complex. Patients are discharged sooner, tests happen faster, consults happen quickly, and care decisions are made hour by hour. It became nearly impossible for a doctor to run a full clinic schedule, answer outpatient messages, manage chronic disease, and safely oversee hospitalized patients throughout the day. Something had to give. So, hospitals developed a model where doctors who specialize in inpatient care, hospitalists, would manage admitted patients full time. This allows your primary doctor to focus on prevention, on long term disease management, and see you consistently in clinic, and allows the hospitalist to be present for changes, review results immediately, adjust care hour by hour, and respond quickly if something shifts. It isn't separation, it's specialization. Well, then what does a hospitalist actually do all day? Let me take you inside a typical day. A hospitalist starts by reviewing a list of patients. That list may include someone admitted overnight with pneumonia, a patient recovering from surgery, someone with heart failure, unstable blood sugars, and someone who came in confused and needs answers. Before they even walk into your room, they already have reviewed your labs, looked at imaging, and read your nursing notes. They have also checked your vital sign trends, looked at your medications, and reviewed your consult notes. Then they walk in. Now, that conversation may feel short, but behind it is an enormous amount of analysis. Hospitalists coordinate lab interpretation, reviewed imaging results, and made medication adjustments. They also have coordinated discharge planning, checked specialist input, had family meetings, code status discussions, insurance authorizations, rehab placement, and home care services. They are the hub. If the hospital were an airport, the hospitalist is air traffic control. The hospitalist model developed because healthcare evolved with advanced imaging, rapid response teams, shorter admissions, and higher acuity patients. Someone needed to be inside the system. Most of the time, hospital care seems like short visits and long waiting. But behind the brief conversations is constant review, adjustment, coordination, because the goal isn't to just get you home quickly, it's to get you home safely. So the next time someone walks in and says, I'm the hospitalist here to see you, it means there is someone coordinating your labs, specialists, nurses, and discharge planning. It means your care has structure, it means adjustments and coordination. I'm Arnold Facklum, and this is Beyond the Stethoscope, where we take the complicated world of healthcare and translate it into something you can actually use. If this helped you, share it with someone who's ever wondered why they didn't see their regular doctor in the hospital. And if there's a topic you want us to cover, maybe something that confused you, scared you, or that you just wish someone had explained, reach out to us through Beyond the Stethoscope